The Motivational Interviewing Treatment Integrity MITI coding instrument, global ratings. We've discussed how the MITI coding instrument is used on a 20-minute segment that's randomly selected of the counselor's conversation with a client. And we've described the different behavior counts assigned to each utterance articulated by the interviewer. We're now moving on to a discussion of global ratings, which are part of the MITI coding instrument, and they give the evaluators what the evaluator thinks is the overall a gestalt view of the practice. So across the different behavior counts, these are global ratings of the quality of the interview and its fidelity to motivational interviewing. And there are 4 of them: cultivating change talk, softening sustained talk, partnership, and empathy. Each of these 4 global ratings are the overall summary impression by the evaluator, and the interviewer is rated on a scale of 1 to 5. And for the purposes of this didactic video, we'll look at what a 5 would be for each of these categories. Cultivating change talk is how well the interviewer brings out an individual's own motivation for change. And so the clinician with a high cultivating change talk rating, the clinician shows a marked and consistent effort to increase the depth, strength, or momentum of the client's language in favor of change. One example would be, let's say you ask the person, well, what do you like about your smoking? And they give you some reasons. And then what do you not like about your smoking? And they give you some reasons. Now, if you gave a summary that emphasized their reasons for not liking smoking, and then you'd be placing an emphasis and you'd be making an effort to increase the client's language in favor of change. Whenever you reflect change talk, you're cultivating. Softening sustained talk. Sustained talk is talk that's given by the client that favors the status quo. So I don't know if I could ever give up smoking. That would be sustained talk. And a high rating for an interviewer's ability to soften sustained talk is defined as the clinician shows a marked and consistent effort to decrease the depth, strength, or momentum of the client's language in favor of the status quo. This often involves not or preferentially reflecting change talk when you hear a mixture of change talk and sustained talk. The next global rating is partnership, and a high rating is defined as the clinician actively fosters and encourages power sharing in the interaction in such a way that client's contributions substantially influence the nature of the session. So such things as, would it be okay if we talked about your smoking? What do you think would be ways that you would be successful in quitting? How might I be helpful to you in quitting? What are your thoughts about this brochure and what would be work for you? So acknowledging the person's a choice not to even talk about smoking cessation, treating them as an expert in what would work well for quitting, and allowing them to determine what would be useful in a plan and what would be useful in terms of whether or not you follow up with them. And finally, the global rating of empathy. High empathy is defined as the clinician shows evidence of deep understanding of the client's point of view, not just for what has been explicitly stated, but what the client means but has not yet said. And often, someone who's high in empathy would gets a high score in empathy, it means that they had a lot of complex reflections. So complex reflections are when you are guessing at what the client means but hasn't actually said, or guessing at what the feeling is behind their words. So often high percent of complex reflections will correlate with a high rating on empathy.